CataractCoach.com. Another resident learns stop and chop. Let's watch together and figure out what case number this is. Here we go. So good draping, lashes out of the way, eye in primary, surgeon sitting superior, and let's see what we get here. Now we sped the video up to 3 times normal speed just so we can get through it in a timely manner. And so here comes some anesthetic, good paracentesis, and maybe something else going in the eye, maybe more anesthetic. There's a viscoelastic, okay, kind of a half fill of viscoelastic. Here comes the main incision, a little bit of a groove there and entering the eye. Nick in the limbo vessels, I like that. Let's see, more viscoelastic, that's pretty good. Let's see, here's a cystotome. Let's get our rexus going. And poking in, flipping that capsule over. Let's see if we can get a nice 5-ish millimeter rexus, more viscoelastic. Hey, viscoelastic is cheaper than vitreous. Now, get that rexus done. And let's see what we got here. Forceps are also marked off like mine. I like that. Don't have to use my forceps. Use any forceps you like. As long as they're marked off, it'll give you a good idea. That looks like a pretty good rexus, probably about 5 millimeters. I like it. I would have made the superior part a little bit bigger, but it's not bad at all. And so there's some hydrodissection, okay. But the cannula right there across it prevents the nucleus from coming up. So that may not be ideal for me, at least the way I operate, because I often like to do a kind of a flip and chop. But okay, works in this situation. So now good hydrodissection to see if that nucleus will rotate. Are we going to rotate it or not? More hydrodissection? Okay, I want to see some rotation. You know the saying, if it does not spin, you will not win. But okay, hopefully it will spin. Let's take a look. Oh, there's a little golden ring of hydrodelineation. Zooming in here more now. Groove down the middle. Maybe looks like a good, nice, that's a good looking groove. I'd widen up that groove a little bit here because here the sleeve is hitting the nucleus. Okay, maybe just crack it in half. Hey, look at that, cracked in half. You got 2 halves now. Now what? Rotate. And let's see if we can do some more separation. Get that crack fully propagated. I like that idea. Buzz in, chopper there, chop that quadrant out. Look at that, efficient. Obviously, it's a lot more efficient at 3 times normal speed, but it's a good job. I'm impressed with the surgeon. Again, chopping the half into quarters, take the quarters out. Look at that short work of that nucleus. Stop and chop in the house. Now, at this point, I'm thinking this surgeon's certainly done more than 100 cases, probably done more than 200 cases. So again, we sped the video up. It's about a 5-ish minute this way, so probably 15 minutes total. Yeah, I'm guessing 200. Hey, did I tell you about our podcast? The #1 podcast in all of ophthalmology with the sole purpose of teaching you the secrets to being more successful in your future. Yeah, I'm totally serious. You will love the podcast. Check it out. It's everywhere where you find your podcast. Apple, Amazon, Spotify, Google, you name it, you could find the Cataract Coach podcast. Look for Cataract Coach or look for my funny name. Now, going back to the case here, cleaning up all that cortex. That looks really nice. Coaxial irrigation aspiration. Clean looking bag. I like it. I like it a lot. For an anonymous resident, you're doing a fantastic job. Look at that. A lot of polishing here. Okay, let's just come out before we break the bag. Don't ask me how I know. So now, let's get some cohesive viscoelastic, fill up the capsular bag. The rexus looks pretty good. Now, all right, you load your own lens. I like it. Looking good. Here comes the lens getting loaded up. I think that's the Johnson & Johnson or the former AMO injector, right? Isn't that it? Let's see what we got here. Looks like a single-piece hydrophobic acrylic lens. Get it in that injector. Let's get that injector going. Zoom in here a little bit, a little more viscoelastic. All righty. Let's deliver this lens. And here we go. Here comes the lens. Deliver. In the capsular bag it goes. Beautiful job there. Yeah, that looks like one of the Technos lenses. Going in pretty nicely. I like it. I'd encourage a little more zoom, but, maybe this is just the recording, which doesn't have the same amount of zoom. Oh, capsule polishing even? Now, come on, that's an advanced technique here. I'm going to revise my estimate. If you're polishing the undersurface of the anterior capsular rim, you've done more than 200 cases. I'm going 350. Or as we say in French, 350. I'm going 350 on this one. This is... No, you've done a lot of cases. That's really, listen, you've done a great job here. I'm impressed. My only question is, if you've done more than 300 cataract cases, which I'm sure you have, come on with the chop already. Just go to direct chop. You don't need to do that groove. Stop and chop's fine. I did a couple stop and chops today, but still was less than 10% of my day's surgical volume. But you could definitely advance the chop. So good job there. I like how you hydrated the incisions, not overly aggressive with the hydration because you have good incision architecture. Lens looks beautifully centered. I bet you this patient is going to love you. This is a beautiful outcome. This is fantastic. I got to applaud you. You did a fantastic job. Just remember, the Cataract Coach podcast teaches you the secrets to success in ophthalmology. I'm absolutely serious. You will love this podcast. Check it out.